Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graben.
Hi, this is Mark Graben. Welcome to episode 336 of the podcast. It's March 14th, 2019. My guest today is Gladys Bogoshi. She is the CEO at Charlotte Maxeke Johannesburg Academic Hospital, which is one of the 10 central hospitals in South Africa and the main teaching platform of the University of the Witwatersrand. The hospital is situated in Johannesburg with a bed capacity of 1,189. Now, Gladys is going to be a keynote speaker at this year's Lean Healthcare Transformation Summit to be held in Washington, D.C. on June 13th and 14th. I'll be there, and I hope you can join us. I'm also going to be teaching a pre-summit workshop based on my book, Measures of Success. I hope you can attend. You can find links to all of that by going to leanblog.org/336. So in this episode, we talk about how Gladys got introduced to Lean, some of the improvements that her hospital has driven in surgery, pharmacy, and other areas. What is her role as a CEO in a Lean journey? What are some of the fundamental behaviors that are important, and how can you coach people on those? We talk about all of that and more. So I also want to thank, again, Catalysis for partnering on this episode and the Lean Healthcare Transformation Summit. I appreciate them for making Gladys available for today's podcast. Hi, Gladys. Thank you so much for being a guest on the podcast. How are you?
Hi, Mark. It's good to talk to you in this podcast. Looking forward to the conversation.
Yeah, and can you start by introducing yourself for the listeners, if you can let people know a little bit about your career in hospital management?
My name is Gladys Bogoshi from South Africa. I was born and bred in Pretoria. I'm a physiotherapist by profession. I qualified in 1985, worked through my profession and went up the ladder until in 2003, I then became a clinical manager looking after, the allied disciplines like your radiographers, physiotherapists, occupational therapists. And as I was there at Chris Hani Baragwanath Hospital, which is one of the biggest hospitals in the world, which has got 2,888 beds, and it was once in the Guinness Book of Records. I was then requested to go and act as a CEO in one of the regional hospitals called Helen Joseph Hospital in Auckland Park, Johannesburg. That was in 2006. And due to the fact that the hospital had not had a CEO for quite some time, I was actually taken aback because I didn't know why me, as I had never aspired to be a CEO, nor even had a thought around that. And as they always say, that the rest is history. I stayed at Helen Joseph for about 2 months, and after 2 months, I was confirmed as the CEO. Now, Helen Joseph Hospital is a regional hospital, as I say, which only offers specialist care. But in 2013, I was then appointed as the CEO of Charlotte Maxeke Johannesburg Academic Hospital, which is a central hospital that performs all the highly specialized services, clinical services. The only thing we don't do is heart transplant at the hospital.
Okay, so you've been CEO there since 2015, and did you get introduced to Lean in this current role, or when did you first learn about Lean and the applications in healthcare?
Yeah, no, I became the CEO here in 2013. And in 2014, I was introduced to Lean by our member of Executive Council, that is our political head, who had a company that wanted to do some social responsibility. And one of our challenges was waiting times in pharmacy. So they came to sort of test the project and introduce us to Lean. But when they came here, I also informed them that, we have a challenge in our theater. Our theater efficiency was very low. So they due to my compelling reasons, they decided to do the two areas, which is waiting times in pharmacy and looking at whether they could improve theater efficiencies. The project lasted for 11 weeks. At that time, I didn't know what lean management was all about, but I saw how they worked because they were working with the people on the ground, and on a daily basis, they'll come and give me feedback about what they had achieved on the day. So that's how I was introduced to lean. After the project, we reduced our waiting times significantly in pharmacy. We divided the area into three. The first one was the patients who were coming to collect medication that is less than 5 items on their script. Those ones, their waiting times came down from more than 2 hours to about 10 to 15 minutes, if not 5 minutes sometimes. And then the second group was the ones that were coming to collect medication that was more than 5 items on the script. Some of them used to wait up to 6 hours, and we brought the waiting times down to about 90 minutes, which up to date we are still maintaining. Sometimes we do fluctuate to about 120 minutes, but we have never gone beyond 320 minutes. The third area was the patients who were discharged waiting for their medication. They also used to wait up to 6 to 8 hours, but we brought the waiting time to less than 2 hours. In terms of the theater, yes. Our theater used to, when I arrived here in 2013, I found that in 2009, a public health specialist had done a study and found that our theater efficiency was at 36%. And that was the reason why I asked them, can't you look at this also? And so having worked there for 11 weeks, we have 33 theaters. So we chose to work only on two, which were both of them were orthopedic theaters. And we improved efficiency in that theater over 11 weeks to about 86%, which we are still maintaining up to today. So to me, it looked like this was, something that works, even though I did not understand how it works. So that's how I was introduced to lean.
Yeah, well, it sounds like it. That first introduction to lean was powerful because it sounds like it was really improving aspects of patient care in a very meaningful way. And I think that's a great place to start. Instead of just teaching lean concepts, let's go prove that there are benefits to doing this, right?
Yes, no, definitely. Because pharmacy used to be our eyesore. Regularly on a daily basis, you'll either get a telephone call or an email or somebody coming to my office that I've been waiting for so long and all that. And to me, it was, if you think a patient experience should be a good one, then people should not even come to my office to request a service in the hospital. But the second thing is that the people who come to our hospital travel sometimes long distances. So my worry was that if they spend 6 hours here and then they spend all this money and all the time, then it means these people are not going to work. And it does affect the impact. It's not only about their health care, it's about their experience. It's also about the financial constraints that they have. With the theater, if we were running at 36%, it meant we were not turning our beds quickly, which means some operations were cancelled. And my concern was that you get very anxious when they tell you that you are going to theater tomorrow. You don't eat, and then only to be told, no, you are not going. So for me, it was just when people come to our service, they must get the experience that is positive and they want to come back.
So who led that initial or the initial projects in pharmacy in the operating room? Did you have a consultant working with you, or was there a specialist who had experience with the lean methodology?
It was a private company that had some money and they wanted to do some social responsibility. And one of the things that they were doing, they had lean experts. So they brought those consultants here. And what was interesting was that none of us, including the people in pharmacy, nor those who came to us, had no idea what these people were talking about. And it really looked strange. But I'm one person who believes in innovation, and who am I to say you can't try it here? And what was interesting, in fact, was that they requested that I identify about 6 people at that time, and 3 of them said not for me. The other 3 said, you know what, we don't know what we are going to do, but we are in. And to date, one of them is actually the lean navigator who came to the Chicago conference and having been called, not knowing and just hitting the ground running. He loved what he saw to the extent that now he's one of our best lean navigators and is teaching lean in the province of Gauteng.
Okay. So this was at the Lean Healthcare Transformation Summit 2018 in Chicago. They attended.
Mm-hmm.
Yeah. We're looking forward to meeting you and hearing you present again at the summit this year in Washington, D.C.
I'm also looking forward to that. I can't wait.
Yeah. So you had those initial projects, and I'm curious if you can talk a little bit. You said at first, it sounds like you were happy with to see improvement, happy to see results. At what point did you start learning more about what lean management means?
Yeah, I think our member of the executive council, the one, as I said, they approached first, saw the results and was impressed, because regularly we would meet with her to give her the results. So she then made a contact with Lean Institute of South Africa and engaged Professor Norman Paul to come and give us a 2-day training on introduction to lean management. That was around 2015, early 2015. And so that's when I realized, so this is what was happening. And what came very clear to me at that time in the 2-day training was that lean is about understanding your processes, standardizing your processes, identifying where waste is, and eliminating waste through a process that is understood by everybody. But I think the second thing that I learned out of it was that it needed teamwork. And, when you do processing, most of the time we would say, well, this is a problem for nurses or whichever type group of people you were seeing. But what I realized was that when you're looking at a patient, you need to make sure that you bring all the role players so that your process is one and it involves everybody. And when you eliminate waste, you eliminate waste from the one that is easy, that you can, do your countermeasures and be able to measure it. So I suddenly started understanding what the consultant firm that was here was doing. And, then I was able to go back to the 2 departments, to ask, if I may call it, intelligent questions, to say, how did you do this? And all that. Subsequent to that, we were then chosen, a few of us, because I run a central hospital. In South Africa, and especially in our province, you have smaller hospitals and clinics referring to you. So I've got about 14 hospitals and a few other provinces that refer to us. So the strategy was that if you train the CEOs of the central hospitals, then when they come back, they can start working with the teams, not only from their hospitals, and maybe we could identify if, let's say, we take pharmacy, all of us can do pharmacy and we share experiences from there. So that's how I came to TheraCare with about 11 colleagues on a crash course. And we learned the lean now. And what was good when we were in TheraCare was not only the classroom experience. We visited the hospitals, We saw how their visual boards were done. We started understanding what is the true north, how you build up your model cells, and, all the things that we learned there. Out of that visit, we were very fortunate that Dr. John Toussaint decided to coach 3 of us in South Africa, which is myself, from Charlotte Maxeke. The second CEO was from Leratong Hospital, and the third one from a hospital called Dr. George Mukare. So in 2017, from February, we went through this training for the whole year on a monthly basis. And that's when I was introduced to coaching, coaching the teams that are implementing the lean in the model cells, but also coaching the teams and my executives on how to implement lean.
Yeah. So you went and visited Wisconsin, and then did John actually come and visit your hospital in South Africa, or was he coaching you through video conference or other technology?
Yeah, what he did is that he would send us the material early in the month, a video, maybe with a few readings from the books and some articles, maybe sometimes questions that we had to do. And once a month, we will then go through what we have learned and share the experiences that we had, including working on our own personal A3. And what was very, very profound, which is still what made me to really believe in the lean masters, was the coaching on fundamental behaviors. So that was mainly our concentration in the beginning. We did this from February, as I said, and in October, South Africa was going to hold the Lean Summit. So when he came to the summit, he then visited, he spent a day at my hospital and a day in the other 2. And he was so impressed with what people had achieved, because we had started other model cells. And I need to mention upfront that just like the first model cells that we did, none of the people were trained, on the lean management. So I had to figure out, how do I coach them and get them to develop them to be their problem solvers with my coaching, encouraging them, guiding them. Occasionally, Oki, the guy that I said started as the lean navigator and still there, he would come and come and help them with maybe a fish bone, or how to collect data, or ask them questions to prompt them. But it was far apart from that. But with that, we got very good results. And Dr. Toussaint was so impressed that he invited me to go to Amsterdam last year to share my experience in Amsterdam with how you can implement lean management with very, very little resources and still get good results.
Yeah. Well, that's great. And I'm curious. I mean, so it sounds like it's very helpful for the lean journey that you are actively learning as CEO. Sounds like you're leading by example. What are, as you try to coach others who work for you, what are some of those key fundamental behaviors that you try to demonstrate and coach others on, fundamental behaviors?
No, thanks for that question. The first one that I learned is to show respect. And not only to show respect, define respect in the context of you being the CEO, who people are used to coming down to solve their problems, but showing respect to say, you are the one who's working in this area. You are the one who knows exactly what is wrong. Or even if you don't know, you can actually diagnose, but you actually probably have solutions that you were not given an opportunity to implement in a an organized way. The second behavior that I learned and I cherish is to be humble. That many a times when you go to the ground and people hear the CEOs coming, everybody wants to run away because the first question that comes to their mind is that maybe there's something wrong and we have to defend ourselves and all that. And what happens now, if I say I'm coming, everybody's looking forward because when I go on a desert, a Gemba or whatever it is that I would be doing there, I'm going to see the good work that they're doing. And so when you come and you are humble, you show respect, you come there to see and to listen in order to learn, not to criticize. It has changed the way the teams are working. In fact, if you don't come, it's like, why are you coming? Why are you not coming to see us? Because they want to show the work that they are doing. The other two, maybe three behaviors that I feel really changed the way I see myself as a leader is standardizing your work, leader standard work. If people know that, you're coming on Monday to see the good work, and then on Wednesday you're coming to do whatever it is that you're doing, and even yourself in your office, you have your own standard work, then you start to reduce the crisis, but to have a organized way of running through your day, with a program that you stick to. Because what would happen is that I would put everything on my to-do list today, and at 4 o'clock when it's time to go home, I find that not even one of those things I had done. And with looking at my diary like that, I found that all the things that I have done were not actually adding value to the patient or the staff or whoever I was serving. You would be doing your paperwork. Yes, you finished it, but did it add value to the experience of the patient who's coming? And then maybe the other one that is really quite important is to have a buddy, because every person, you are human. Yes, you may live here with very good intentions that you are going to see the good work, but sometimes you don't see yourself that you are actually going back to your old behavior. So if you have a buddy, you're able to get somebody who is not judgmental, who just gives you positive or negative feedback in such a way that it helps you to grow and mature more into this. And what I've noticed is with all these and all the others that I can talk about, if you work on your behavior, then it becomes easy to change the culture of an organization. Because then everybody who goes to the next level, they go there to see the good work. When they go down, they show humbleness. When they go look at anything, they're not judgmental. They're not going there to listen so that people can respond, but they go there to listen, understand, and learn what people are telling you about. And still now, with all the financial constraints that we have not been able to train a lot of people. But, the last model cell that started in ICU where they deal with infection control, the only thing I had with them was just to talk with them and brought the 2 other model cells to encourage them. And the next time when I went 3 weeks later, I just could not believe what they had done. The motivation level, the determination to reduce the infection rate in that ward. They have no idea what is this, Lynn. In fact, as we talk most of the time, when you say, what about this? They say, excuse me, what are you talking about? And then you have to stop and say, oh, a Gemba is go see and what have you. And when we say, what are your countermeasures? They look at me as if I'm from space because they've never been trained. But once I explain what is a countermeasure, boy, they get into business. They put them and they work on them.
Mm-hmm. You make a lot of really good points there, and I think it's really interesting your observation that it's helpful for everybody to have a coach, and because it's not easy sometimes to change behaviors. I'll say that, myself included, that it's helpful to have somebody observe and point out things that we might not notice ourselves. So I appreciate you, really appreciate you sharing that.
Yes, no, I think you're right, especially because, as I said, from 2015, we've been exposed to the lean management. But what I find is quite critical is the coaching that is linked to the lean, because the coaching keeps the sustainability, but the coaching gives people motivation, because when you go there, you're coming to see the good work. And most of the time, before we leave, we say, what are we celebrating today? And sometimes, you think it's a small thing, like today we managed to finish all the patients on time. But you see the smile and the happiness on their face that, they really, it was probably something that was bothering them. But today, because they've done it for the first time and they did it on their own without anybody helping them, you just see the happiness that they do. And tomorrow morning, they say, you will see, give us 2 weeks. We will then even finish before, the end of the clinic. Mm.
Yeah. So can you talk about some of your goals for this year or the coming years? What are some of your goals for Lean, other than continuing to coach people and trying to spread some of these behaviors? What are you hoping to accomplish, and how will those Lean accomplishments contribute to the goals of the hospital or healthcare for you?
No, thanks for that. Fortunately, the model cells that we chose, when we were coached by Dr. Don Tusand, we had 6 what we call our minister, our Secretary of Health in your terminology, asking us to reduce waiting times, which was not specific, by the way. So anyway, where that people are waiting long, you had to do something about it. The second one was the staff attitude. The third was the patient safety. And if you take that infection control, you would also put it under patient safety, because if somebody gets infection while they are in hospital, the chances of them maybe dying or maybe having very poor outcomes, health outcomes, are very high. But it also talked about cleanliness, that how do we keep the environment clean? And also in terms of ensuring that our medication, we do not have a lot of stock out. So when we then, as I was introducing it to my senior management, we then said, no, let's just go through this, because all of them are relevant. And so the staff attitude, we said, with the coaching, we're going to look at how many complaints we reduce, because we measure our complaints. Our patient safety, we looked at all the things, patient falls and what have you. The waiting times, I've mentioned some about that. And the cleanliness, we actually mixed the cleanliness with the infection control and the patient safety. And so if you take that, for me, my wish is that we are already starting to work on our goals. But what is very important for me is to see the model cell being made up of different people. If you look at the infection control one, we have a security at the gate who's working with the clerk, who's working the patient clerk, and the cleaner who cleans the ward, the operator who cleans the machines, the doctor and the nurse. They form a model cell. And they have taught each other about their dependency so much that the cleaner now is the one who teaches the doctors how to wash their hands, because she understands that she's also a health worker in a way, and she contributes towards saving lives. But the second thing that I would like to see is that people must own up to their problems in their improvement cycles, to improve and to continue doing them all the time. through working as teams and not only just, accusing, if I may put it in inverted commas, because most of the time we say, if so-and-so was doing something, I would be performing better. Most of the time when they say, it's so-and-so who's doing this, I said, but do you know how he works? Would it make sense if we go and see what he's doing? And many a times, in fact, all the time when they come back, some of them come back and say, see, we are so embarrassed. What we thought it was the problem was not actually the problem. And most of the time you find that they feel sorry for the other people because they thought they were the problem, only to realize that, in fact, maybe even then, they are a problem to them. So my wish is to really see ourselves as the whole hospital, because this is a big hospital. We've got about 5,000 employees. We have 1,068 beds. If we all can see ourselves as health workers, whether you are a health worker as a nurse or a clerk or a porter moving patients, see yourself as contributing towards the health well-being of the people who use our service.
So Gladys, how widespread would you say the interest is about lean in South African hospitals or other parts of your healthcare system?
In Gauteng, in the public hospitals, there has been a lot of interest because people have seen the work that we have done, a few of us who have been trained. But in the private sector, we are starting to see interest. We've had few people also coming to visit us. And with the Lean Summits that we are holding in the country, we are seeing interest growing. The second province that I know is actually getting big is Western Cape, where they've also adopted Lean as the way of improving, bringing a continuous improvement and, developing their staff. So I think it may not grow as fast as we would like to, but there is some interest that we are seeing.
Well, and I'm sure there'll be continued conferences, and the Lean Institute South Africa, I've met Norman before, so I know he's doing a lot to try to help promote Lean, and you're getting great coaching from John Toussaint. So there's a lot of positive things where hopefully your influence and your leadership and the approach that you're taking will spread as people hear more about those success stories. And speaking of conferences and sharing lessons, again, I want to mention to the listeners that Gladys will be one of the keynote speakers at the Lean Healthcare Transformation Summit. It's being held this year in Washington, D.C., June 13th and 14th. I will be there and look forward to hearing Gladys speak. And I know you have a lot more. Don't want to ask you to give away everything here in the podcast. I know you'll have more to talk about at the summit. But maybe a final question for you, Gladys. What advice, other than what you've already shared, and you've shared a lot, do you have other advice for hospital CEOs, regardless of where they are in the world? Advice for them about how to have the best impact and the most sustainable impact with Lean?
Yeah, for me, what I've learned out of the whole experience and the advice I can give is, if you are a CEO, are you willing to change? Are you ready to make sure that you let the people on the ground, the frontline workers, develop them so that they can solve their own problems? Are you willing to have a standard work? Because once you have the leader standard work, it becomes easy to go down to the frontline workers to preach the leader standard work and share with them how it can be done. And lastly is to show respect, humbleness, and I believe that nobody leaves their home to come and harm a patient. It is the system that is a problem. And if our frontline workers understand when you come, when there's a problem, that you are not saying that they are the problem. You are saying the system is broken. Let's fix it all in a very organized, scientific way so that we can be able to measure our results, do our countermeasures, put targets that are achievable, and sustain them, because that's the most critical thing. The second advice I can give everybody is that at many times I always say in my office, the boss is my personal assistant, because she knows what's going on. She directs all of us. Otherwise, if all of us are personal assistants, nothing is going to go right. So how do you utilize the people around you to be your frontline workers in your own office? Because if you get it right there, then it becomes easy to go out to the staff, the other frontline workers.
Well, that's great advice, and I appreciate you sharing your experiences, Gladys. And again, very much look forward to meeting you and hearing you speak at the summit. So thank you very much for taking time out of your busy day, and we'll certainly look forward to seeing you soon.
Thank you very much for giving me this opportunity. I'm also looking forward to meeting all of you, learning also from everybody. And I'm sure people will learn from our South African experience.
Yeah, because a lot of the things you talk about sound very universal and transferable. I think a lot of this seems to be human nature, organizational nature. So thank you for in advance for traveling such a long distance and for sharing your insights with everybody. And thanks again for being here today.
Thank you very much, and all the best to you.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.